Hi, parents and viewers. Welcome to today's edition of Talk Child's Health with Dr. Q Merita. Today, I have someone very special to my dear heart, my darling husband, on this program today to talk us through an important topic in his specialty. His name is Dr. Okhaide Aigbokhai. Welcome to today's
Thank you.
program.
Thank you very much. Thank you for inviting me to the program.
All right, so today we're talking about snoring in children. Is it normal for children to snore, or is it a sign of a problem, or are there things that we have to look out for to suggest that there's a problem? So, over to you. Is snoring in children normal?
Thank you. So snoring has been a very big issue that is we are seeing increasing number of children that are snoring. And the straightforward answer to that is that regular snoring in children is absolutely not normal. By regular snoring, if a child is snoring about 3 or more times in a week at night, that is absolutely not normal. Occasional snoring is acceptable, especially when the child is having some upper riser symptoms like upper respiratory tract infections, there's stuffy nose. Occasionally, you can snore, yes, but when it becomes habitual, it's a problem. It means that there is a blockage in the airway. It means that there is some obstruction in the child's breathing.
All right, thank you very much for that intelligent answer. The next question is, what are the common causes of snoring kids?
Yeah, for us, the causes of snoring in children are fairly very consistent. By that, you can say, yes, these are the common causes that can happen, occur in children and make them snore. And on the top of my list is the adenotonsillar enlargement or hypertrophy, meaning that the tonsils and adenoids are big, causing obstruction. What are the tonsils and adenoids? These are just some lymphoid tissues that are located in the throat and at the back of the nose that act as the first line of defense in offending allergies, infections. So they can get big, and when they get big, they can remain big and cause significant obstruction, blocking that airway, causing snoring in these children. 80% of snoring in children is as a result of this. There are other causes like allergies, especially children exposed to different kind of irritants, things irritating the airway, and make them go
Okay.
consistently or persistently snore. Something that is gaining grounds now and causing this noisy breathing and snoring in children is obesity. So we are seeing a good number of children that are becoming on the big side, becoming obese, and is has caused one of these problems in breathing for these children.
All right, thank you very much, babe, for this intelligent, quiet answers. Next question. So, what signs should make a parent worry?
Yeah, thank you. The snoring enough is enough to make a parent worry when you have a child that is having this noisy breathing. And you can hear the breathing by the foot of the bed or across a wall or next door. You can hear the child breathing. But if you have other things with the snoring, for example, what we call obstructive sleep apnea, OSA, child ceases to breathe, pauses during breathing, and suddenly try to gasp for air or snorts. That's a significant sign or symptom that you should cause your parent to worry. Other things that your child is consistently opening the mouth to breathe and having malign dentition. His teeth are not properly forming. They are not in the right position. These are signs or symptoms that you should worry about,
Okay.
especially if your child is having this noisy breathing and you're having a child who is restless, constantly restless,
Okay.
having a restless night sleep, or even in the morning, he feels very tired, weak, lethargy. You're having poor attention in school, not able to concentrate. These are the effects from poor sleep, restless sleep, especially when children are having this poor sleep as a result of obstruction in the airway.
Thank you very much for that answer, babe. The next question is, can snoring affect a child's growth or development?
Oh yes, snoring can indeed, the obstruction can cause a distortion in the growth and development of a child. If there's significant obstruction and the child is suffering, not breathing appropriately, working against significant resistance, he's expending more energy and burning more calories. And if that is not matched with what he takes in, of course, there will be compromise in weight gain. In addition, this obstruction can cause some children not to be able to perceive normally or get good food and that reduces their appetite. And with the very low appetite, of course, there will be this apathy taking in food, and that would affect the entire growth and development. Now, remember that growth hormone, which is one of the hormones required for linear growth in children, is secreted especially during deep sleep. And that is when most of these growth hormones are secreted. So if the child doesn't get to that point of sleeping deep, of course, and if this continues for a long time, there will be some compromise in his growth and development. I remember that the sleep wake cycle of the brain not fully sleeping at night can affect his cognitive development. And you start having issues with cognition, cognitive decline, and poor attention. All this as a result of poor sleep. Additionally, some of them can also have these recurrent throat infections or recurrent tonsillitis. If you don't have this chronic recurrent tonsillitis, of course, they will not be able to take in food and swallow food. So the issues of not being able to eat will be persistent, and that will affect their growth and development.
So the next question, when should the parents see an ENT specialist? When should a parent see an ear, nose, and throat specialist?
Yeah, it is important that you recognize these symptoms on time, and we advise as early as possible. If your child is having these symptoms and it's lasting up to a month, you should see an ENT specialist. If having these symptoms of snoring coupled with the other things I've mentioned, you should see an ENT specialist. The earlier you see an ENT specialist, gives you that leverage, gives you an opportunity to ensure that the child reaches his full potential in terms of development, and not allow the child to continue to suffer in silence.
All right, thank you very much once again. Do children outgrow adenoid and tonsillitis, or do some need surgery?
Yes, the adenoids and tonsils, the adenoid especially has a natural history. We expect that there is a peak in growth at around 3 to 7 years, an average of 4 years. That's when it peaks in growth. And by 8 years, it starts to decline and reduce in size. And by the time we get to 12, it has completely disappeared. So for some children who have very mild symptoms, we usually would say, observe. You see us and we observe. These symptoms are mild. We assess to know whether these symptoms are mild, and we say, let's wait and watch and wait and just observe the child. But for children who are suffering, we can recognize children who are suffering. Why will you want to keep a child, make a child continue to suffer? This child actually would need to have intervention so that they can achieve their full potential and change the trajectory.
Thank you very much. Parents are very worried when you tell them their child needs surgery.
Mm.
Is surgery really safe in children? As a surgeon who have practiced for some years now, will you say surgery is safe in children?
Well, I will not talk about surgery generally, but I'll talk about, because of this topic, adenotonsillectomy, which is the surgery we do for children with obstructive adenotonsillar enlargement. It is safe in children. These surgeons have mastered the art of this surgery. Many children undergo this surgery and are able to assume their full potential after the surgery. The effects can be very remarkable and can be very immediate. Success rate is about 90%. It's even higher in some centers that have good, sophisticated monitoring equipment for these kids. So we say it's a safe procedure because these surgeons all over the world have mastered this
All
art.
right, thank you very much. And what can parents do at home to help before seeing a doctor?
Well, at home, if your child is snoring, home measures include trying to decongest the nose, remove that stuffiness in the nose. You can use things like, we call them over-the-counter saline drops or touches. Parents can use that. We have often advised parents to reposition their children, especially when they sleep. Instead of lying supine on their back, they can be prone. The head of the bed can be elevated. This will reduce the noise because those tissues are coming together and blocking that airway.
What happens if parents decide to ignore the snoring?
Well, ignoring this snoring, parents would do that at their own risk because you have denied your child the opportunity to attain his full potential and cognitive or brain developments. Apart from the fact that they don't attain this, there are also very serious health concerns that we have seen in children who have stayed so long before they seek help. There is significant cardiovascular risk meaning that your body is working against so much resistance, and that can affect the heart. The gases that are piling up also in the body can also affect the heart. And for these children who are chronic mouth breathers, they start to develop a certain kind of facial appearance called the adenoid fascia. You see them very long, oblong face, receded chin. They have an open mouth posture. Their teeth are not well aligned, poor dentition.
Thank you, Doctor. Thank you very much for taking your time to
You're
be
welcome.
in this program today. I really appreciate it. And parents, you've heard it all. Snoring is not something to ignore. You have to look out for the red flags. If your child snores a lot at night and suddenly stops breathing while they sleep, or during the snoring episode, or during the day they are quite sleepy, look very tired, or you've noticed that they're not growing well, please seek medical attention. In Talk Child's Health with Dr. Kumarita, we want our children to sleep well, to grow well, and to stay healthy. So please try as much as possible to look after your child, pick up the red flags, and seek medical help. All right. If you have questions that you want him to answer, you can drop them under the comment section. Or you want a particular topic in ear, nose, and throat surgery that you want him to talk about before he's totally done with us, because he's going to spend some sessions with us. Just please drop it and we'll really appreciate and we'll answer the questions. Thank you very much for your time. Thank you very much for joining us today and have a nice day. Bye.